So that gives our pelvic floor opportunities to respond to increases in pressure. So intra-abdominal pressure is something that we all have as part of our core control mechanism. And me just standing up from a chair would increase intra-abdominal pressure. So intra-abdominal pressure is not bad. It's something we all have. It's about how we manage it. And when we are pregnant, we have a lot of changes that are happening within our body due to hormones, due to stretch of the muscle body, stretch of the connective tissue, a shifting center of gravity as our belly is starting to grow out in front of us. And we have these kind of subtle adaptations that happen. And sometimes we do end up spending a bit more time in that posterior tilt, either because we sit tucked or because when we're standing and our belly is growing out in front of us, sometimes we kind of want to lean back a little and push our pelvis forward, almost like we're using our pelvis like a bit of a shelf to help hold up our belly. And all of those things can again contribute to more tension in that group of muscles. And we aren't as able to manage those increases in pressure as well. So one of the things that happens if we're not managing pressure well is incontinence. We have little bits of urine leaking out. And during pregnancy, as the babe is growing, things obviously on the inside are shifting as well, and our bladder has a little bit less space. So you may find yourself going to the bathroom a bit more frequently. But you also may find that when you laugh or when you sneeze or when you pick something heavy up, that you notice a little bit of urine leaking out. And that would be considered stress urinary incontinence. It is common to experience it in pregnancy. It's common to experience afterwards, but it is not normal. And as soon as you notice it, we want to get on top of it, because we do have some research to show if somebody experiences stress urinary incontinence while they are pregnant and don't address it, the chances of them still experiencing it 5 years postpartum is significantly higher. And a lot of things that we can do, there are a lot of things we can do. One being paying attention to our posture, as we mentioned, releasing some of the tension. So we can use things like tennis balls, and we can sit on them. If you lift up a butt cheek and you roll the ball inwards so that it's in between the sit bone and the anus, and then we would try to soften our muscles over that ball, that can help release some tension. And it's a really good way to introduce sensations that it's not like we're going to feel like we're sitting on a ball when we're giving birth, but sensations of stretch and pressure and discomfort. The more we can sense and feel those while we are pregnant and learn how to soften and surrender into them. Usually when we feel discomfort, we want to draw away, but we have to surrender. We have to allow that to happen. So the more we can introduce those sensations while we're pregnant, the more likely it is that we will be able to tune into our body while we're birthing to be able, again, to find that ease when things might feel a little bit uncomfortable.